Hello, and thank you for your interest in the Occupational Therapy Assistant Program at McLennan Community College. This presentation replaces the traditional face-to-face information session provided every year at the college. So exactly what does an occupational therapy practitioner do? Well, they're facilitators of a patient or client's process to return to their highest level of independence possible. The profession's philosophical base emphasizes that health involves body, mind, and spirit in total integration. How is our service important? Well, consider that dysfunction in any part affects the whole person. For instance, if a person loses the ability to walk, it's not only his or her legs that are deficient. The entire being is profoundly affected. And what is occupational therapy? In its simplest terms, occupational therapists and assistants help people of all ages participate in the things they want and need to do through the therapeutic use of everyday activities, which we refer to as occupations. So what do I mean, occupations? Well, a common term associated with occupational therapy is activities of daily living. Activities of daily living are the everyday activities most people perform on any given day. So here you see some examples of those activities of daily living. Also included are these items. Occupational therapy helps people function in all of their environments, whether that's home, work, school, or community, and addresses the physical, psychological, and cognitive aspects of their well-being through engagement in occupation. People are complex, and no one size fits all in planning and providing therapy services. A client's occupational performance is impacted by many different things. Performance skills are a client's demonstrated abilities. One's occupational performance can be impacted by performance patterns that either help or hinder their performance and are individual to each and every client. How one does things is also very individual and reflects the who, where, what, when, and why of the activity. So occupational therapy is a problem-solving approach that relies on critical thinking to evaluate function, analyze the activities, design intervention that facilitates engagement in the occupations. Who do we serve? We serve all ages, and they represent a wide range of disabilities in these many categories. Where do they practice? In a wide range of settings. Here are some of them. According to the Occupational Outlook Handbook, which surveys all occupations and presents job seekers with an overview and projected value of professions to consumers, a career as an OTA, an occupational therapy assistant, has a bright future, as you can see from these statistics. Now, the occupational therapy practitioner themselves, what type of individual is a good fit for this profession? These are some characteristics shared by most occupational therapy practitioners. The Occupational Therapy Assistant Program at McLennan Community College is a 2-year program leading to an Associate in Applied Science degree. It begins each year in the spring, and the applications are due each preceding fall on October 30th. Upon graduation, the student will have acquired entry-level skills into the profession. They then must successfully pass the National Certification Exam administered by the National Board for Certification in Occupational Therapy, the NBCOT. It is passing this exam that bestows the C of COTA. You may have heard of COTAs. That's a Certified Occupational Therapy Assistant. They then must apply for and receive a Texas state license through the Executive Council of Physical Therapy and Occupational Therapy Examiners. These are the admission requirements for the Occupational Therapy Assistant program at McLennan Community College. There are also a list of prerequisite courses to enter the program, all of which are taught at MCC. Co-requisite courses, as you see here. Also, you are required to have volunteer or observation hours as part of your application. Due to the current situation, this requirement is undergoing a temporary modification because of the social distancing during COVID-19. Please check the website frequently for the updates. You'll also be asked to supply references, one from an occupational therapist or occupational therapy assistant, and the other form may be completed by another reference, like a supervisor, a teacher, or an employer. Typically, these are acquired in those observation situations, but again, due to the current situation, we are modifying temporarily the requirement for this, so it's applicable in a different fashion. You'll also need to undergo a background check. And please note that if you have any criminal convictions, you are advised to contact the program director for further advising because it may impact your ability to sit for the exam. You must have proof of health insurance and these immunizations, background checks, drug screens, and proof of having completed an American Heart Association Health Provider Basic Life Support course. So occupational therapy assistant essential skills and requirements include physical and mental requirements, communication skills, intellectual skills, behavior, and professional conduct and appearance. These are characteristics that will be assessed in your application. I hope this presentation answered some of your questions and you're ready to look into it further. You will have made a good choice in doing so. Thank you.